So the key points post back surgery. First thing is making sure that obviously that the wound's healing. And then it's looking in terms of how much neural mobility you've got. So most physios will look at things like lying on your back, and we call it your straight leg raise, so looking at how mobile you are in terms of flexibility and what type of symptoms do you get. So do you get anything in terms of any pins and needles or the numbness that you may experience post-operatively? Because if you think about it, they've been in and they've decompressed around the nerve, and that's normally the reason why you have spinal surgery. So the nerve's still going to be quite sensitive in those first 2 to 3 weeks post-operatively. So along the lines of that then, in terms of your rehab, it's about keeping a very neutral spine, and it's being imaginative in terms of your exercises. So we can start to look at how we can load the legs and also looking at loading the lumbar spine, but keeping everything very neutral. So that's why we use quite a lot in terms of weight bearing, and also the things like the reformer can be particularly useful at this time. Flexibility wise, things like knee fallouts, and using some light band work for resistance just start to get some activation around the trunk. Mobility is key, but what you have to watch about mobility is, particularly if you've got some nerve and some neural tension, particularly in the lower limb, is that you don't start to force it. So you're looking again at just getting some range of motion, but not aggravating that nerve tension. So again, it's nice slow mobility work, and that can include from anything from sort of like the foot position all the way through to the neck. So we look at things like the mobility of the soft tissues around, and that's where some soft tissue therapy can